Well, welcome everyone. I hope you've been enjoying Interactions Live. It's been an interesting year for all of us for sure, and we appreciate you joining us virtually. We've been hard at work sharing some of the exciting things ahead in the next year for inContact, and we've also been looking across some of our top customers to identify some great thought leaders to share their experiences and best practices with you. Today, we're going to check in with the University of Miami Health as they share insights into how inContact has helped them transform their contact center operations. Our agenda today is we'll do a brief introduction on University of Miami Health as well as Precision Point Partners. We'll talk a little bit about the UHealth contact center operations. We'll hear about some of the opportunities that led for a call to change. What were the successes in making a comprehensive launch, the resulting improvements, and then what are the advantages through the pandemic, especially timely right now, of course. And then we'll close it for some Q&A. So our featured speaker today is Carrie Danner. Carrie brings 25 years of contact center experience in operational management and client delivery. She is currently responsible for the Ambulatory Access Contact Center at University of Miami Health, which includes over 400 agents and is a 24/7 operation. We'll also be speaking with Miguel Ramos, a close partner of the university. He's partner and president of Precision Point Partners and has a unique focus on helping organizations execute on customer experience strategies. So let's take a quick look at the transformation, a year in review. We're going to look at three different things: learning, research, and results. So first, how did the university recognize the need for change and how did they address it? Secondly, from a research element, what did they do to plan for and address the change? And then third, how were they able to track their success and what they accomplished? And what does that mean for them going forward? So without further ado, I'm going to hand it over to Miguel Ramos. Miguel.
Thank you, Brian. And thanks for allowing Carrie and I to share our UHealth journey here at Interactions Live. As a bit of background, P3 is a boutique firm with over 40 advisors providing people, process, and technology consulting. As you mentioned, we led the patient experience journey for UHealth in partnership with Carrie. This journey led us through the selection process and ultimate implementation of a comprehensive inContact deployment. Our firm specializes in optimizing that customer/patient experience by driving business process advisory results. Today, we're spending a lot of our time helping people enable the work at home process. And we also provide overall managed services. Our global customer base is a mix of healthcare payers and providers, corporate clients, government agencies, and private equity funds. I'll turn it over to Carrie now, and she can share a little bit about University of Miami and the University of Miami Health System. Carrie?
Thank you, Miguel, and thank you, Brian, for giving us the opportunity to share some of our transformation with everyone. UHealth is part of the University of Miami Health System. Basically, we're an academic center that's powered by the research and the innovation of the Middle School of Medicine within the university itself. We've got about 1,200 physicians and scientists that are basically covering over 100 medical specialties across 30 outpatient facilities. Two of the best known are probably Bascom Palmer Eye Institute. It has been named number one eye hospital in the U.S. 19 years, 17 of which have been consecutive, and the Sylvester Cancer Center, which is the only NCI designated cancer center in all of South Florida. A little bit about UHealth Connect specifically. The actual contact center that I oversee is currently about 400 agents. These individuals are currently working from home as a result of COVID and some of the initiatives that we'll talk about a little bit later today. But it consists of primarily a centralized patient scheduling center. That's about 3/4 of the actual team. But we also have some other specialty groups, physician paging, which is a 24-hour service for on-call physician support. We have a customer service and patient access team. which answers questions, simple questions such as location, directions, what type of insurance do we take, and what type of doctor do I need to see based on certain criteria. And then we've got an omni-channel patient outreach center. And what that does is a lot of different outreach to the for different things such as rescheduling appointments or referrals. But the key thing here and what we were able to leverage from a NICE environment is just the different channels that we communicate with patients, whether it's SMS, whether it's ACD, the dialer, and email. And then we have the physician logistics teams, which is very similar to workforce management, but think of that for the actual providers and making sure that we've got the appropriate schedules there. Miguel, I'll hand it over to you now to talk a little bit about the implementation.
Thanks, Carrie. Just as a bit of background, so P3 was engaged by UHealth to optimize the patient experience journey and to establish a comprehensive strategy for that journey. We mapped out the previous environment or the current environment at the time for UHealth Connect and identified areas of opportunity. The previous environment was 100% on-prem. There were quite a number of different point solutions that weren't completely integrated. Omnichannel, WFM, outbound, and some other solutions were not in place at the time. And they were using a costly and somewhat limited third-party SMS reminder solution, which is a big part of the operation. Once the current environment and business needs were mapped out, we developed a comprehensive roadmap outlining UHealth Connect's business goals and needs compared to the current environment. We targeted a budget-neutral transition. We insisted on an improved patient and employee experience. The mantra from day one was cloud first, moving away from a legacy on-prem solution. We needed an integrated, easy-to-use, and low-cost SMS platform. This was critical to the decision. We also wanted to deploy a comprehensive set of omnichannel capabilities, which were not available at the time for UHealth. The roadmap we developed acted as a guide for the selection process of a new platform and for the ultimate deployment of a new streamlined, lower-cost, integrated environment. What we deployed fit and in many cases exceeded all the requirements and business goals for UHealth. The solution was cloud-based, which required no CapEx or additional hardware to be installed. It integrated and had some great results with a courtesy callback solution. We also brought in workforce, RTA, and scheduling to help round out the solution. We also used quality management and feedback management as a part of the overall plan. Finally, we brought in an integrated low-cost SMS capability. With the roadmap we created as a guide, we developed and released an RFP, and this RFP went out to 6 providers. The process led to the down selection of 2 providers and ultimately to the selection and implementation of NICE inContact. Precision Point led a comprehensive implementation of the process, and that process included ACD IVR, or the CXone platform. This included 700 skills and over 500 POCs. We deployed Personal Connection, the outbound solution, which also integrated SMS reminders. We deployed quality management and call recording, workforce management, feedback management, and quite a few interaction channels that were deployed. We also implemented an AI-based performance management and coaching solution. The implementation led to a 100% cloud-based solution with NICE and Epic, UHealth's EHR system, at the core. Carrie, I'll turn it back to you to tell us a bit about post-implementation results.
Thank you, Miguel. And we've definitely seen some tremendous improvements across the board. Ever since we had the implementation, we started off with really just learning a lot more about our business, being able to be proactive in getting an overall picture of staffing and where some of the gaps were around some of our processes has really helped us move into the next phase, which is overall process improvement. A lot of what we were seeing was issues with forecasting. So we were able to utilize or leverage the workforce model in order to create proactive staffing models, create dynamic scheduling. We were able to do enhance our actual QA process. One of the things that we found extremely important was the calibration between our supervisors and the QA team. We didn't have that before. That was one of the things that we identified as a gap. And through the utilization of the actual team and actually even that functionality, we would definitely see an improvement there. Also, one of the things that we were able to leverage is all of the different channels that inContact offers and communicate with our patients really in their preferred method of communication. We found that some of our patients preferred to have communication via SMS. Others continue to, prefer phone calls, and in some cases, they prefer email as well. This gave us the capability to be able to communicate with those patients in the best channel for them. Overall, that really led to metric improvements. Our forecasting accuracy now is within plus or minus 4%. Utilizing that in the new staffing models, we're able to drive a 65% improvement in our abandonment rate. That was also facilitated with the use of the courtesy callback system, which our patients really, really like. We tend to use that a lot during high volume days, like on Mondays and sometimes on Tuesdays. The AH team definitely saw some reductions. Where we utilized there was really not only the real-time visibility into it and managing it real-time, but also even utilizing features such as the call disposition and being able to drill down into specifically those that we were seeing higher handle times and listen to the calls and determine what's driving that and what other process changes do we need to make to drive that. We expect actually to see even more improvements on the handle time. We're about to implement CTI, and we're expecting that that's going to drop at least 30 to 45 seconds from that as well. Average speed of answer also improved. Again, that is attributed to the forecasting and the staffing opportunities there. And then quality, we talked about that already a bit, and a lot of that again was the visibility and some of the additional features that the quality system offers that allows us to better calibrate with the team and provide consistent coaching across the board. Cost reductions were actually pretty big for us. As we all mentioned before, we were looking for something that would be cost neutral. We actually ended up with something that has a saving about $500,000 a year. Part of it was operational efficiencies. I'd say probably about a third of it. Although we've ended up growing, the system, it wasn't as a result of our performance. It was actually that we've been absorbing additional responsibilities over the past year. But when you look at that core business, we definitely saw some efficiencies there and cost reductions associated with that. But a big portion of it was the fact that there were so many different systems that we had before that have a cost associated with it. There's licensing. Because they were on-prem, there were hardware costs associated with it, then individuals to manage and maintain those systems. And even when you look at even phones, now we went to soft phones. So overall, when you package it up and you compare the costs of our old outdated systems compared to what we have today, there was a significant savings associated with that. Probably 2/3 of that $250,000 is of that $500,000 is related to just the comparison with the two system or licensing costs in general. But not only did we achieve cost reductions, but we also saw we have gained some additional capabilities. We've got now, as I mentioned, SMS, one of the things that's become very popular with our teams and the different departments that we've established. The system is sending SMS. So instead of telling people to visit a certain website or go somewhere for a form, we have the ability to send them, the SMS. So we've got additional analytics that we didn't have before. We have additional quality systems capabilities that we didn't have before. And just overall channels. We have chat capabilities. We have the ability to have email in a form that you could actually manage it and manage service levels. So that was definitely a plus. And then the employee satisfaction. The employees actually love the fact that the system is very easy to use. We train our agents. It takes about 15 to 20 minutes to train them on how to use the actual system high level. We usually give it a little bit more for questions and answers, but it's a very simple system. It's very intuitive, and the team loves it. From a leadership perspective, it's been also extremely popular with everyone because of just how easy it is and how comprehensive the information is, not only real time, but also the ability to run reports and create certain ones and save them so that you can run them again later. That's been a plus as well. And then finally, just the inherent business continuity with having, a cloud-based solution, has been a real focus for us, and it's been a real win. When we think about the advantages of the inContact system, the reaction of the university through the COVID-19 really, I think, speaks loudly to those advantages. Whether you're looking at simple implementation of new services, we were able to get certain call centers up within a 24 to 48 hour period. The system itself is extremely flexible for different work environments. We were able to get 400 of our employees to work at home within a 2-day period. So work at home is very simple. Basically, all anyone needs is a laptop or a device or a mobile phone and an internet connection. It has tremendous ability to scale. As I mentioned, we had gone from 3 to 400, but very quickly, within a matter of 60 days, we scaled an extra 750 employees and didn't have to worry about hardware or licensing. It was just a matter of, we request additional licenses, and within minutes, those are granted. No consideration to ports or anything else, fully scalable. The ability to activate new channels. There were certain channels that we had not yet gotten around to implementing. So for example, email and the SMS through the dialer system or IVR initiated SMS. These are all things that we partnered with inContact, and we're able to get those turned on within a matter of hours as well. And so when you look at all of the things that as a healthcare organization we had to implement, it was tremendous. So not only supporting from a telephone perspective, setting up all of these different additional groups and contact centers, but also new processes, enhanced reminders to patients, letting them know about some changes in policies related to, let's say, visitors, or security or safety, safety tips, a new arrival, process where patients check in from the comfort of their car, so that we can maintain some of that social distancing. It facilitated contact tracing, also again through both our dialer application and making outbound calls, as well as through some surveys that we were sending out through SMS. And similar to that, we have several additional processes that we were able to benefit from having the actual platform that is so extremely flexible.
Yeah, thank you, Carrie. That was fantastic. Love hearing about the advantages, especially through the COVID-19 pandemic. I think now we'll open it up to questions, and would like to hear a little bit from our audience. Okay. Well, great information, guys. The first question that we have coming in is a question. I guess I'll put this one to you, Miguel. Why did you ultimately end up choosing Nice in Contact?
That's a great question. So obviously they met all of the specific requirements. Very quickly, we saw that they were among the top providers that we were looking at. But the ultimate decision really was kind of twofold. One, Nice inContact was extremely easy to work with. So we found that all the way from a contracting standpoint, negotiation standpoint, all the way through the launch, they were extremely easy to work with. And second, we from existing capabilities I mentioned, as well as future capability standpoint, we really felt that they were the best mix for University of Miami.
Great. I have another one here. I'm going to throw this one to you, Carrie. How have you been able to maintain KPIs through the pandemic?
That's a great question. And one of the best things that we have with the use of the system is the fact that everything is at your fingertips, and it's all web-based. And so for us, it's really just one big virtual contact center. We've always had about a quarter of our staff that works remotely, but we still have access to all of the information, on the dashboards. We still continue to manage our service levels real time. We have implemented some other tools where we're constantly communicating with various teams. We've implemented, and these are Microsoft tools, so Microsoft Teams, where we can have certain communications, and those are set up by teams. And then there are holistic, ones, but there's constant communication between our workforce management team and our supervisors, as well as with our employees.
Great. Thank you, Carrie. Let's see. Question 3. Let me ask you. Let's see. Who am I going to send this one to? I'll put this one to Miguel, I believe. Now that you guys are fully implemented, what are your next steps?
Yeah, also a great question. So for us right now, I think the next steps is really to move towards advanced speech recognition. We're using basic touch tone as well as speech recognition, but there's a extreme ability, I think, to add some additional capabilities with ASR. Robotics and automation is also a big part of what we're looking at. We've had some great improvements in the KPI side, but we think there's an ability to take that to the next level through some automation. And then we're, I think, extremely intrigued right now with some of the advanced routing capabilities, like personality-based routing and other capabilities that Nice inContact is putting in place.
All right. Thanks, Miguel. Fantastic. We have a question coming from someone who's in the process of moving to CXone, and the question they have is: do you have any advice on how to get agent buy-in to the change? I'm not sure which one of you want to take that one, but I will. I think it's a great question.
I can actually take that one. One of the things that really worked out well for us was the actual methodical implementation of it, educating them, on what the change was going to be, but more specifically, what are the benefits that they were going to gain from utilizing the platform. And some of those benefits were, again, the flexibility. They no longer had a hard phone sitting at the desk that they'd have to come in and log into versus just having everything set up within their desktop. They had the ability to, set follow-up reminders for themselves, and be able to see actually, if they had to transfer a call, what their peer was doing, and so that they could have a proper process or transfer process. So there's a lot of features, the callback feature. So there's a lot of features that they were going to be gaining. And that's really what actually helped us, was putting together almost like a comparison, really, and an outline of what these features were going to be, and then actually demoing it for them so that they could see just how simple the system was to use, much more simple than what they had before.
Great. Great. Let me move on to the next question here. We've got some really good questions coming in. Of those listed, what was the single most salient improvement realized after implementation?
I would say, God, there's a couple. I would say for us, everything really starts off with having the proper staffing, and I think that the visibility into not only our volume trends, and being able to firm up that forecasting process and a proper proactive staffing plan really has helped us then be able to factor in things such as time for coaching and time for refresher training, and even some downtime where we have certain activities with the agents. But everything really goes back to actually staffing, because if you're not staffed appropriately, it makes it very difficult to be able to have some of those additional activities that help also improve your overall service offering. And so if I had to pick, because there were multiple things, that was probably number one. And then I would say it's closely followed by the quality aspect of it and the functionality that we have there, as well as the analytics tools. So I think I gave 3 instead of 1, but everything really, for us, it does start with proper staffing, because it impacts everything.
Great. Now we've got a few questions coming in here that are the same, and a lot of folks want to know, how long did your implementation take?
I'll take that one. So we chose to stagger the different solutions, right? So I think a part of the buy-in for the agents too was we didn't throw everything at them all at once. We chose to stagger the solutions. One of the complexities that UHealth had is there's over 700 skills and 500 different POCs coming into the interaction. So the first group of skills in the first team, which was the Bascom Palmer Eye Institute, was up and running within about 45 days. And that included really transitioning over probably close to 100 of those skills that just Bascom itself had, and the POCs. And then we continued to really just stagger the capabilities. We launched CXone. Shortly after that, we launched QM. Shortly after that, we launched Workforce. And then we kept on really just going through the process of launching all the different platforms. We wanted to do it in a way where it was methodical and really where the team would not have been overwhelmed by just having too much thrown at them all at once.
Great. Another question here. How many new hires have you obtained to manage and handle everything implemented with NICE inContact?
New hires as in, well, I guess there's a couple things. You mean for support? I would assume we have 2 system administrators that were brought on, and those 2 system administrators basically support everything regarding that platform. And so not only for the contact center itself, but remember, we've gone from the 300 we originally had in just our contact center now to multiple departments and multiple contact centers, and we've got over 1,200 people on that right now.
Wow. Okay. Interesting. And then another question here: Do you use a CRM? And if so, are you able to connect the interactions in CXone to records inside your CRM at the client account level?
Yeah, that's a so. Karen's gonna love that question.
So there's two things. We have an EMR system. We use Epic, and we're currently actually on the market right now looking for a CRM solution. However, we do have integration with Epic. We're in the process, as Miguel mentioned earlier, in the process of actually implementing CTI, which again is going to be additional implementation into Epic. But we currently have integration, for example, for the texting solution. There's files that are pulled from Epic automatically and text messages that are sent. We have the same thing with the dialer. So there's information that's being sent back and forth within NICE and Epic. And again, we'll continue to do further integration with it.
All right. Well, I think that takes us through our questions here. I'll put a last call out to the audience. These have been some really great questions. Sorry, Miguel, were you saying something?
No.
Nope. Okay. So I'll put a last call out to the audience to see if there are any other questions that you can that you'd like to ask. I think this has really been fantastic, both Carrie and Miguel. Greatly appreciate you sharing your story with us. I do not see any other questions coming in, so thank you everyone for joining. This has been a great, great story to tell. I do greatly appreciate Miguel and Carrie both being here to talk about the successes that University of Miami Health has had, and I hope you enjoy the rest of Interactions.
Thank you, Brian.
Thank you, guys.
Thank you.